Well, the push to decriminalize marijuana is continuing across the state. In Denton, residents voted to decriminalize the drug months ago, but the city council recently voted to not adopt the ordinance, leaving the policy in limbo.
And, similar pushes to decriminalize marijuana have failed at the state capitol.
Yeah, Ardilla's Sky explains what was lost this legislative session.
It was a legislative session that featured several high-powered conversations on topics such as immigration and property taxes. However, one area that really seemed to hit the back burner this time around was that of cannabis.
That would have been a big win for millions of patients.
Reese, Chief Marketing Officer for cannabis healthcare provider DocMJ and a chronic pain sufferer, believes not expanding compassionate use this legislative session was a missed opportunity.
Chronic pain is the most common qualifying health condition in over 47 states that have legalized cannabis. For Texas patients to not have access to medical cannabis if they have severe and debilitating chronic pain, it just doesn't seem right.
The Compassionate Use Act provides low-level THC cannabis to qualified patients. However, millions of Texans don't meet the requirements and face the dangers of prescribed opioids, which the CDC stated was a major factor in 5,000 overdose deaths in 2021 alone.
They're not a permanent solution. And that's why I believe so strongly that patients should have access to legalized medical cannabis, which is doctor supervised. And so they can use that as an alternative health option safely.
Dr. Rohan Patanker is one of those physicians and says for medical reasons, the state needs to give medical cannabis serious thought.
I think if the political elected leaders just take a look, not bring political stigma into it, but just base their decisions in hard science, it's a very easy decision that this is far better than the current options that are out there.
In total, about a dozen bills regarding cannabis, including recreational use for increased revenue and decriminalization, were simply not high on the agenda, says UT professor and executive director of the Texas Politics Project, James Henson.
You start to lose support when you get in the realm of more recreational use. But there's a lot of support, including among Republicans and conservatives in the state, for compassionate use. And I expect that that's where we'll continue to see, both advocacy and lobbying efforts going forward. And probably the biggest chance of there being progress.
Reese, the Toronto native turned Texas resident, says will take 2 more years. Then millions can wait.
While that doesn't sound like a long period of time, for someone who's experiencing pain, relentless pain on a daily basis, that's an eternity.
Thanks for watching our YouTube channel. For more refreshing stories about your community, click the subscribe button over here. You can also download our Spectrum News app and tune in to Channel 55 on Dish and DirecTV to get live news coverage, weather updates every 10 minutes, and more. We'll see you then.